All right. Well, welcome. Thanks for joining. My name is Rachel Ishak, and I'm with the Brain Injury Alliance of New Jersey. And we're a statewide nonprofit that supports people who've had brain injuries and concussions. And we also do a lot around trying to educate the community about these things and try and prevent them from happening. So I'm going to talk tonight about concussion and brain injuries. And so feel free, if you have any questions, feel free to unmute yourself, type it in the chat. Hopefully I'll see it and I can answer it, and then also have some time at the end for you to ask any questions. We could talk a little bit. So I'm going to start out here. Today, we're just going to go over what a brain injury is, what concussion is, talk about some of the symptoms, the signs, and how it can affect a person, and then talk about how it's managed and what recovery looks like, and then talk at the end just a little bit about some recommendations and resources for people who might have a brain injury or a concussion. And so I like to just start off by having you think about maybe somebody in your life who's had a concussion, because concussions are very common. A lot of us have had them. We know somebody who's had them, but we don't always know a lot about them. So think about maybe somebody you know who's had one. Think about maybe some of the things that they experienced, some of the challenges, and try to apply some of what we're talking about tonight to that person or yourself, if that was the case. So when we talk about the brain, it's really in control of everything that we do, right? This morning when I got up, I walked to the bathroom and to brush my teeth, and then I went downstairs and I calculated how much to put in the coffee maker when I was making my coffee. I looked outside and I was sad because it wasn't summer anymore. And all that was really done by my brain in just a matter of seconds. My brain controlled my breathing, walking, talking, thinking, feeling, and behaving. And so it's the most important organ in our body, and we want to make sure that we're protecting it the best that we can. And our brains are actually the consistency of Jell-O. So if you think about a plate of Jell-O, if you were to drop it, it would kind of fall apart. You wouldn't be able to put it back together the same way. It's very fragile. And so we need to protect our brains. And there are two terms that we use when we talk about brain injury. We're not going to go too deep into them, but there are types of brain injuries that are considered non-traumatic or acquired. And this is something like a stroke or a brain aneurysm or some type of infection that can affect the brain. But then you have your traumatic brain injuries, which I think we're a little bit more familiar with. And this is caused by some type of external hit to the head. That could be like falling down the stairs, getting in a car crash, which we're going to be talking about and focusing more on today. And there are three levels of severity when it comes to brain injury. There has been a little bit more of a recent push to be a little bit more specific in the way that we talk about them, because to say mild, moderate, severe isn't very descriptive. But this is kind of what you'll see in any of the literature. So a mild brain injury, in that case, somebody would experience some symptoms like vomiting, nausea, dizziness. They may experience a loss of consciousness, but they may not. And if they do, it would be under 30 minutes that they were unconscious. And then something really important to note about mild brain injuries is that they are not evident on an MRI or a CT scan. So if you thought you had a brain injury that was really mild, you went and got a head scan, you're not going to see anything on the head scan. But then in the case of a moderate brain injury, somebody would lose consciousness for anywhere from 30 minutes to 24 hours. And they would experience some contusions or bleeding on the brain, and you would see something on some type of neuroimaging in that case. And then in the case of a severe brain injury, somebody would be unconscious for more than 24 hours. That could be days, weeks. And then you would definitely see some signs of trauma on a neuroimaging scan, and they might have some type of post-traumatic confusion or amnesia. But what I want to highlight today are concussions. So concussions are actually considered mild traumatic brain injuries. A lot of times we think of them as just kind of getting your bell rung, but they are a category of a mild traumatic brain injury. And they can happen from hitting your head against something or being pushed and the head moving. So if you were, for example, in a car crash and you didn't hit your head on anything, but the force of the crash lunged you forward and backward, that could actually cause your brain to rattle around within your skull and can cause a concussion that way. And so concussions are temporary, more or less, what happens is there's a temporary change in the way that the brain is functioning. And so that's why you'll see some symptoms related to it, but it's not a change in the actual structure of the brain. Something like a mild, moderate, severe, more severe, mild, that sounds odd, but in those cases, you would see some type of structural damage or injury, but not in the case of a concussion. And so this is just a short little video that kind of shows what happens inside the brain when somebody sustains a concussion. There are some technical terms about axons and everything, but I think it paints a pretty nice picture of what it looks like and how it can affect a person. So hopefully you can hear that.
Each year in the United States, players of sports and recreational activities receive between 2.5 and 4 million concussions. How dangerous are all those concussions? The answer is complicated and lies in how the brain responds when something strikes it. The brain is made of soft, fatty tissue with a consistency something like jello. Inside its protective membranes and the skull's hard casing, this delicate organ is usually well shielded. But a sudden jolt can make the brain shift and bump against the skull's hard interior. And unlike jello, the brain's tissue isn't uniform. It's made of a vast network of 90 billion neurons, which relay signals through their long axons to communicate throughout the brain and control our bodies. This spindly structure makes them very fragile, so that when impacted, neurons will stretch and even tear. That not only disrupts their ability to communicate, but as destroyed axons begin to degenerate, they also release toxins, causing the death of other neurons too. This combination of events causes a concussion. The damage can manifest.
So you'll just see there that when those axons begin to break down, somebody might experience some of those different symptoms related to a concussion. So how might someone sustain a concussion or a brain injury in general? In the United States, actually, the leading cause of traumatic brain injuries are falls, especially among older adults. But it's not just among older adults, young children as well. That's one of the leading causes. So just falling, tripping over something, falling off a chair, all of those things. Car crashes are actually the second leading cause of traumatic brain injuries in the United States. Pedestrian and bike crashes. So if somebody's walking across the street and they get hit by a car, or if they're riding on a bike and they get hit by a car, those are common as well. Sports and recreation, which is, I think, what we most often think of when it comes to concussion. You know, we automatically associate it with football or soccer, but those are also very, very common. If somebody is going up and they collide with another player, they get hit in the head with a ball, all those things can happen. Something we don't think too much about too, but domestic abuse. So there's been a lot of literature recently and a lot of research been done connecting traumatic brain injuries and domestic violence. And then workplace injuries. So if somebody's on the job and something hits their head or they slip and fall, those can cause concussions or traumatic brain injuries as well. And then this last box here, it's not actually a traumatic brain injury. It's what we would call an acquired brain injury, but it presents in a similar way to traumatic brain injuries. And I think it's just important to recognize that any type of suffocation or drowning or exposure to poisons like lead or carbon monoxide, they can cause brain injuries similar to a traumatic brain injury or concussion. And so we call concussions and traumatic brain injuries a silent epidemic because it's happening all across the United States with very little awareness. So every 21 seconds, somebody in the United States experiences a traumatic brain injury. And it's estimated that there's 5.3 million Americans living with a disability because of a traumatic brain injury. And we call it silent because it's not like other types of injuries. So if I were to fall and break my arm, I'd probably wear a cast. You could see that I was injured, and if I wear a cast for a couple of weeks, I'll probably be fine. But in the case of a brain injury or a concussion, you can't see it. It's not visible the same way, and it also doesn't heal the same way. So you can't just put a cast around your brain or do surgery to improve a traumatic brain injury or concussion. And how prevalent really is it? So when it comes to traumatic brain injuries, 611 people are hospitalized every day because of them. And there's 176 deaths per day in the United States because of traumatic brain injuries. Most often it's happening among older adults who are over the age of 75, but there are thousands of kids and adults who also experience traumatic brain injuries every year. And specifically when it comes to concussions and youth, studies have found that 15% of high school students sustain a concussion every year, and that's just at least one. Some kids are sustaining more than one every year. So these are really, really high numbers. And we like to point out that brain injuries and concussions are very unpredictable in how they're going to affect a person. So we'll talk a little bit about the signs and symptoms, but it's really just a range of symptoms that somebody could experience. Not everybody's going to experience that thing, and they're not always going to experience it with the same level of severity. And that's because every person's brain is a little bit different. Every person's brain is wired a little bit differently before their injury. And then every injury itself is different. So the way that the brain is damaged when they get injured is very unique. And then every person adjusts differently to the changes that come from their injury. So the way that they choose to cope or maybe compensate for some of those issues is very unique. So we never want to make any assumptions as to what somebody might be experiencing if they say they have a concussion or that they have a brain injury. So what might be the signs and symptoms? If somebody fell and hit their head, or if they collided with another player, if they're playing sport, how could you know that somebody sustained a concussion or a brain injury? There are a few signs that you might see right away or within the first couple of hours. One of those is confusion. So if you talk to them, maybe they're not able to respond appropriately. They might seem disoriented. They might not know where they are, what they're doing, who they are. If they have a loss of balance, so maybe they get up and they start walking around, but they seem a little unsteady on their feet, that could be an indication. Changes in mood and personality as well. So sometimes after a concussion or a brain injury, they don't seem themselves. Maybe they're talking and they just seem a little bit off, or their mood has shifted. And so maybe you can't pinpoint exactly what it is, but they're just acting different. That could be a symptom as well. A delay in answering questions. So if you speak to them and they take a long time to process what you're saying and then respond, that could indicate a concussion as well. Headaches are one of those hallmark signs, especially if they get worse and worse over the next few hours. And then loss of consciousness. We'll talk a little bit more about that later, but somebody doesn't need to lose consciousness to have sustained a concussion. But if they do lose consciousness, that's a pretty telltale sign that something happens. So that's what you would see in the moment that somebody sustained a concussion, or something that you could see. But then there are more longer term effects that could come from it. Now, a lot of these are more in line with other types of brain injuries, like mild, moderate, severe. So if, in the case of a concussion, somebody would likely not have long-term impacts, although we'll talk a little bit more later about post-concussive syndrome and what that might mean. But these would be in the case of a little bit more of a severe brain injury in that case. So if somebody sustained a traumatic brain injury, they might have changes in their smell and their hearing. They might not be able to hear correctly. They might have ringing in their ears. Their vision might change. They might have a nearsightedness, or they might have blurred vision, double vision. A lot of times, people who've sustained traumatic brain injuries have fatigue and sleep disturbances, so they're not able to sleep at night, or they have trouble hitting REM appropriately. Changes could happen in their speech, their balance, their coordination, and even their ability to walk around and move the different parts of their body. And then we see a lot of headaches and even susceptibility to seizures. And some of the hallmark signs of traumatic brain injury are the cognitive changes that could happen afterwards, the biggest being memory loss. So a lot of times after a brain injury, people have difficulty retaining information, especially if it's new information. They might have an impairment in their ability to reason or understand things properly. It might take them longer to understand things and process it. They might have trouble being able to articulate themselves verbally and communicate properly, use the correct words, and their attention might be impaired. And then completing tasks, organizing themselves, all might be a struggle for someone after a brain injury. And then mood and behavior changes. Some people experience just irritability, anger, frustration, depression, with no real trigger after having sustained a brain injury. And that's just because of the difference to their brain and the structure that happened. So I really just threw a bunch of different symptoms at you, but what does that really look like in somebody's life? So this is actually a clip from a fictional movie called The Lookout, and in it, the main character sustains a concussion or traumatic brain injury in a car crash. And this is his life 4 years later. He's struggling with some of the symptoms related to the brain injury. And I like to show this so that you can just kind of see what that looks like in the life of a person rather than just a list of different symptoms. So keep your eye out, see if you can pinpoint any of those things I just mentioned.
I wake up. I turn off the alarm. I look outside so that I know what to wear. I take a shower with soap. And then I shave. Sometimes I cry for no reason. But I'm getting a handle on it. I wake up. I get dressed. I take my meds. When Lewis is gone, I make the coffee, which can be tricky. I eat breakfast, but I don't read the paper. It confuses me, which makes me mad. I wake up. I put on my coat and go to class. I wake up.
Ten more seconds. You're just doing one day, okay? No big deal. And time. It's okay, Chief. It's not a test.
So hopefully you may have noticed some symptoms that he was experiencing. I'll just mention a few. He definitely had some difficulty with memory impairment. So he needed to use a watch to set reminders and then look at his little notebook to tell him where he needed to go. He had reminders all over his house telling him where things were and what he needed to do for the day. He couldn't put things in proper order. He kept saying he woke up and then he did something, they woke up. And then he struggled with mood changes. He said he gets angry or sad, cries randomly. So those were just some of the things that you could see in here. And so I want us to think a little bit now about kind of the facts or the myths that we may have heard about concussion and brain injuries, because there's a lot of information floating around, especially now when it comes to hearing things about sports and football and the NFL. There's a lot of facts and information flying around, but what's true about some of these things that we've heard? So I'm going to highlight a few different maybe facts or myths that you might have heard of and whether or not they're true. And the first one I want to highlight is that most concussions don't actually involve a loss of consciousness. It's less than 10% of concussions that involve a loss of consciousness. So just because somebody doesn't lose consciousness doesn't mean that everything is okay. Somebody could definitely still have a concussion even if they never got knocked out. And that a lot of concussions are misdiagnosed or not even diagnosed at all. We were talking earlier before we started about how to actually diagnose a concussion. And really up to this point, there isn't any type of real diagnostic tests. You can't just go to the doctor and have them do a blood test or a scan to say you have a concussion, because as I mentioned earlier, it doesn't show up on an MRI or a CT scan. So it's kind of hard sometimes to diagnose. And so a lot of times either it goes underdiagnosed or misdiagnosed as other things. But thankfully now with a lot more awareness, there is a lot more concussions being diagnosed properly. I mentioned that they don't show up on a CT scan or an MRI. So if you do go to the doctor having a concussion, unless there's something deeper going on, you're not going to see anything on those scans. And then somebody brought this to my attention one time. I'd never heard of it before, but somebody said to me, well, I've heard that children and people who are under the influence of alcohol, I've heard it that they don't have bad concussions or they don't injure their heads if they fall because the alcohol loosens their body up, their muscles are a little bit more free flowing, or children bounce back quickly. Those are not true. Statistically, we know that people who actually are under the influence of alcohol are at a much higher risk of sustaining a brain injury. And the more alcohol that's in their system, the more severe the injury is going to be. And with children too, a lot of times we see that it takes them a longer time to recover than adults. So those things are not true. We also know that there's a cumulative effect of repetitive head trauma. So this is also becoming more popular in the news if you've ever heard of CTE, chronic traumatic encephalopathy. And basically all it's saying is that the more you expose your head to banging around, the worse it's going to be in the long run for a person. And so we're seeing that now more in the statistics and the research. And then this one is often surprising to a lot of people, but very important to recognize that helmets don't actually prevent concussions. They help prevent skull fractures and serious injuries to the head, which is super important, but they don't actually prevent concussions from happening. And that's because concussions happen when the brain rattles around within the skull. And a helmet doesn't actually prevent your head from moving, it just prevents things from penetrating it from the outside. So while helmets are super important and very good, they don't actually prevent concussions from happening. And so who can diagnose a TBI or a concussion? A physician, a neurologist, or a sports medicine physician who knows about concussion and can make that diagnosis. So they'll ask questions about your symptoms, about what happened, and identify whether or not it was a case where something could have happened to your head, and then kind of align it with the symptoms and see if that was truly a concussion that happened. So what does the recovery process look like from all of this? Just in general, with traumatic brain injuries, it depends on the symptoms that somebody is experiencing. So if they're experiencing symptoms related to their motor abilities, they might go see a physical therapist or an occupational therapist. If they're having trouble with their speech and language, they might see a speech pathologist. Or if they're having trouble with some of those cognitive changes like memory impairment or processing, they might go to a cognitive rehabilitation specialist or a neuropsychologist. So it all just depends on what somebody is experiencing. And we really like to mention that the severity of the injury doesn't necessarily determine the symptoms somebody's going to experience or the outcome. So for example, if somebody sustains a severe brain injury, that doesn't mean they're never going to be able to make a recovery and live a productive life. Some people who've had severe brain injuries make an amazing recovery and have very mild symptoms that affect their life years later on. But on the flip side, somebody sustains a mild traumatic brain injury, that doesn't mean it's necessarily mild. They might experience really severe symptoms for a long time that really impact their life. So we don't always want to make that assumption that they correlate. And that in the case of brain injuries, sometimes things don't always return to the way that they were. So after somebody sustains a traumatic brain injury, they might not be able to fully regain some of those abilities that they had before. And rehabilitation can be a slow process. So somebody could go to a therapist and maybe make some really great improvements, but it could take months, it could take years. So it's really important to be patient in the rehabilitation process as well. And in the case specifically of a concussion, what does the recovery look like for that? Well, it's different for everybody. Just as I mentioned earlier, every person is different. The impact that they had to their brain is unique, and the way that they are able to compensate is all really, really personal. So we never want to say, well, you know, it's been 2 weeks, they should be fine by now. It's different for every person. Nevertheless, we have seen that in most cases, symptoms usually start to resolve within a couple of weeks, about a month. If somebody is having symptoms beyond a month, it's really important to go to a doctor just to follow up, because there could be something more happening and they want to be able to track that. And so how should we manage a concussion? I think if you looked at research 20 years ago, they would say, go sit in a dark room and don't do anything for a couple of days. But now that kind of has changed with what we know about concussions. So doctors do recommend that you rest immediately after the injury. You want to give your body and your brain some time to heal. But then they have shown that actually your body and your brain improves better if you get back to doing some light and relaxing activities after the concussion within a couple of days. So after you rest for a day or two, try to get back to some of those things that you have been doing. Maybe go on a light walk, read a light book, do some of those things to keep your brain moving and your body active, but monitor your symptoms. So if you are going on a walk and you notice that you're starting not to feel good, kind of scale it back and give yourself some time to rest and then try it again. And then it's a process where you want to be kind of stepping up every time. So you start to do a little bit, you do a little bit more, and eventually you'll be able to get back to your regular activity. But throughout this whole process, it's really important, if you have a doctor who had diagnosed you, to just be asking them what they recommend, because they're going to be treating you and being able to give you some better recommendations as to exactly how much you can be handling. And just some other recommendations then about prevention and managing a concussion. Why is proper management important? So I mentioned earlier this thing called post-concussive syndrome. And basically it means that your symptoms are lasting longer than they normally would. So for a couple of months or even years. And a lot of times that can happen if you don't manage a concussion properly. So if you start to use your brain a little bit too quickly, or if you expose yourself to more head trauma before the concussion has recovered, you put yourself at risk for having longer symptoms and more severe symptoms beyond what you should have. And also, if you return too quickly to doing things and you're too active before your concussion is healed, you're also putting yourself at risk for worse effects, like long-term effects from the head traumas that accumulate, but also second impact syndrome. So this is something that has stumbled doctors a little bit, but there have been cases where somebody had sustained a concussion and they went back to their activity a little too soon, and they got hit in the head a second time before they'd recovered fully. And they actually passed away, or they had really severe damage due to brain swelling. And physicians have found that it's because of the second hit to their head that they sustained before the concussion had recovered. And so we want to be very careful not to put ourselves at risk for getting hit in the head a second time before we're fully healed from the first concussion. So really, if you think you have a concussion, if somebody hit their head, they're not feeling well, whatever it is, just err on the side of caution and get it checked out. Go to a doctor, tell them what happened, explain the symptoms, and help them to be able to make a proper diagnosis. And if you do have a concussion, make sure you give yourself time to heal. Don't try to get back to things too quickly. Don't put yourself at risk for hitting your head a second time. Play it safe, because your brain is really important. And so what are things that you can do to prevent a concussion or prevent a traumatic brain injury? The first is just walking and driving safely in the community. So I mentioned that car crashes are the second leading cause of traumatic brain injuries. And in New Jersey specifically, 30% of car crashes are pedestrians getting hit by cars. So they're walking across the street and a car comes and hits them. So it's really important that when we are behind the wheel, when we're walking, that we do it safely so that we can prevent getting hit by a car or getting in a car crash. And some of those strategies could be, if you're walking at night, making sure that you're using reflectors or bright clothing so that cars can see you, making sure that you're obeying the rules of the road. So if you are crossing, you want to cross at a crosswalk or an intersection when it's your turn to walk. And when you're driving, not speeding, not driving under the influence, not distracted driving, all those things. And if you are participating in some sports or recreational activities, wearing a helmet, I mentioned earlier that it's really helpful for preventing some more severe injuries. Studies have shown that it actually reduces the risk of severe brain injuries by 80 to 90%. So it's really effective in keeping your head safe that way. So making sure that you have a helmet that fits properly, it's the right size, and it's adjusted to your head in the right way. If you're in a car, making sure kids are wearing their seatbelts or they're in car seats if they need to be, again, to just limit the impact that could happen in a car crash. And then I mentioned reflectors earlier. And if a child is playing sports, making sure that they're playing according to the rules, so they're not using equipment to hit each other inappropriately, or they're fouling people when they shouldn't be, making sure that the surfaces are clear. I went to a soccer game recently, and in the middle of the field, there was just a hole. There was a chunk taken out of the ground, and they let the kids play on it. They didn't fill in the hole, which I thought was extremely dangerous because kids were tripping in that hole and they weren't really paying attention. So making sure that you're setting yourself up for success wherever you are and not putting yourself in danger. And then just exercising caution and being aware of your surroundings. So as I mentioned earlier, a big cause of concussions and traumatic brain injuries is falling. So just being aware of what's going on around you. Is there stuff on the floor that you might trip on? Any wires that are coming out of your TV? Do you have clutter on the floor? Do you have adequate lighting in your house? All of these things are really important to make sure that you can properly navigate your surroundings. And if you are, with somebody who has sustained a brain injury or concussion of any kind, there are a few things that you could do to just help them out a little bit. So if they are struggling with processing, just speaking slowly so that they have more time to really process the information that you're saying to them and really digest it. And then break things down into smaller pieces. So if you're throwing a lot of information at them all at one time, it's going to be really hard for them to grasp any of what you're saying. So just give them a few little pieces at a time so that they're able to digest it. Make sure you're not using really abstract concepts or words, be very concrete in how you're communicating. And if they are struggling with some of those memory impairments, you can help them out by just suggesting that they use reminders. So if they want to use a reminder on their phone, if they need checklists, anything around the house that might prompt their memory or jog their memory can be really helpful. And then lastly, just repeating information. I know this can be frustrating for us, but for somebody who does have a hard time remembering things, the best thing you can do is just remind them, not get frustrated when they ask you to repeat something, even though you just said it a couple of minutes ago, or you talked about this yesterday. Whatever it is, just kind of encourage them to be able to repeat that information, even if they might be struggling to remember it. And so if you're looking for more information about some of this stuff, the CDC has a lot of information about concussions and traumatic brain injury. The Concussion Legacy Foundation as well is really huge, and they're also really big in speaking out against the NFL, so they have a lot about sports-related concussion stuff as well. And then Brainline and the Brain Injury Association of America have a lot of information. So feel free to check out these resources. They're really, really awesome. And then we have some resources as well. On our website, we have this pocket concussion recognition tool. So it's just a nice little pamphlet that shows you what to look for if somebody hits their head, some of the symptoms and signs of a concussion. So if you are somewhere and you're not sure what to look for, you can have this handy and you'll know when to seek care if they're demonstrating some of these things. And so I'll just wrap up very, very quickly with kind of what we do here at the Brain Injury Alliance. We do a lot for the state of New Jersey. We have direct services, we do education and prevention, and we also have some advocacy on behalf of people who have sustained brain injuries. So if you know somebody, or if you yourself have sustained a concussion or a traumatic brain injury and you're struggling to get connected to resources, for example, if you're trying to find a good doctor, or you need information about accommodations in school, whatever it is, you can contact us. We have a helpline, and we also have free case management services. So we'll assign you somebody to kind of walk alongside you in this process, guide you, give you information. So that's free and available to anybody in the state. And then we also have support groups for people who have sustained brain injuries or for caregivers. And then we do a recreational camp during the summer for individuals with brain injuries. We do a lot around education. So we'll do workshops like these. We'll go into community groups, schools, professional agencies, and we'll just talk about some of these things to raise awareness. We have some trainings throughout the year for health and human service professionals and for people working in the field of brain injury. And then we have webinars throughout the year as well. So if you're ever interested in keeping up to date on some of the educational opportunities we have, you could sign up for our newsletter on our website. And then we have this fantastic program called the You Got Brains Champion Schools program. And any school in New Jersey is able to participate, and we have the students put together a safe driving campaign. And so they'll come up with a social media campaign, t-shirts, and they'll hand them out to students, whatever it is. And they submit to a panel of judges whatever campaign they come up with, and they're able to win a cash prize for their school. So this is a fantastic program for kids to educate other peers about safe driving. And we have some information about safe driving on our Jersey Drives webpage. And we do have a legislative network that advocates for change for individuals with concussions and brain injuries. So all this stuff, you can learn more if you're interested on our website. We have social media accounts, Instagram, Twitter, YouTube, Facebook, you name it. So feel free to check us out, follow us. If you have any questions, you could always reach out to me. My information is here, my email address right there. If you have any questions, feel free to ask. If you're looking for information, please don't hesitate to reach out. So thanks so much for listening and coming. And now I just want to take a moment to see if you had any questions or any comments before we wrap up.